Hello beautiful people, how are you guys doing? I hope you guys are doing okay. Today is Monday, September 5th, 2020, and it is 7 o'clock in the evening. I'm trying to go home. Stop by, the place I live, basically. My third home, the grocery store. I feel like I'm here out of the 5 days work week. I feel like I am here at least 3 of it. Anyways, today's going to be a very quick video regarding my last update, unless I get something new regarding what's going on with me, if anybody cares. But anyways, this will just help me remember what had happened before, and so that if anything new changes or if I forget some important detail, I can go back to my videos and remember. Ooh, that was a sneeze and a cough together. Alrighty, so this whole entire thing started May 21st of this year of 2020. I have history of migraines. I've had migraines for a very long time, 7+ years. I did all types of medication that I can think of. Nothing really worked. It would work, but then it will stop working right after, or it would be tablets to take and I will forget to take them. And you know how tablets are, they will work for one thing but could affect another. And I just wanted something that I could do either once a month or once every few months. Either I can inject, or someone do it for me, like a provider's office, whatever, something that I could just do one time for either a month, 3 months, 6 months, a year, whatever, that kind of thing, because that way I don't have to remember taking medication on a daily basis. I am horrible with when taking medication. I'm supposed to take allergy medication on a daily basis and I forget. My vitamins, I forget. I will forget to take it. So with having something that is administered either in a clinic or I have to pick up from pharmacy that's done once a month or once every 3 months or whatever, I'm much better at it. So anyways, I was getting Botox from my one provider. His name starts with an H, so I'm going to say Dr. H. He used to do my Botox. He did it 5 times, but he left the system. He no longer works at the hospital I work for / I'm patient of. He actually moved out of state. So since he doesn't do it anymore, I had to find somebody else. I see at the time I was seeing 2 neurologists. One neurologist that did my Botox, the procedure. He was actually the main neurologist of the whole entire hospital. The second person is the person that I see on a yearly basis as a maintenance follow-ups from neurology, and also that does my FMLA paperwork. I see her, that's her, it starts with a V. I see her once a year, or maybe twice a year, depending on what I need. So V, my provider V, Dr. V, referred me to see Dr. T, who is a plastic surgeon that does Botox for cosmetic reasons and also for medical reasons. I saw him March 1st, March something like that, early March. He gave me paper form to fill out, and I was supposed to come back within a month, but since the COVID, everything was shut down. The unnecessary procedures were canceled for further notice, and that was like for 3 months. So I had form I had to fill out for 3 months, and I did. And actually I'm glad I did it that way, because they were able to see how much I get a migraine throughout the month, and I did it for 3 months, so it was a really good data for them to put in my chart, so that they can definitely send it to my insurance and let them know, like, hey, she really suffers from migraines, she really needs this, XYZ, whatever situation is that relates to migraine, it'll be in there. So I saw him May 21st for my procedure. He did the procedure. I felt a headache that day. I felt dizzy that day, just a little bit dizzy, not too much. I thought maybe it's because where he administered the Botox is a different location than Dr. D administered the Botox. Within like a day or so later, I experienced tightness in my jaw and my neck. That lasted about 3 weeks. I spoke with him every week regarding that, the tightness in the jaw and the neck. He said that will loosen up within 3 to 4 weeks, which it did. But on a week after I got my Botox, I experienced extreme dizziness. That was May 28th, and I am still experiencing dizziness. It has not stopped. Some days is a lot worse than others. Today I have been a little bit dizzy. I say like half the day I was dizzy. I'm a little bit dizzy right now driving, which is not that great. I shouldn't be vlogging, but I just need to get this up. I've been trying to get this up for the last 2 weeks, and I need to be up to date. So I talked to him about the dizziness. He said the dizziness has nothing to do with the Botox. He probably think I might be dehydrated, or I'm tired, or whatever. So I made sure I had enough fluids in me. I bought some Gatorade, Powerade, ate healthy, drank healthy, got some rest over the weekend, thinking that, you know, that the dizziness was on Thursday, thinking by Monday I'll be fine. I wasn't. So I got seen at my clinic where I work at. I'm like, maybe I might have vertigo since I'm still dizzy. It was like 3 days. I'm like, I'm still dizzy. So I'm like, can you just treat me for vertigo? She's like, cool. Gave me meclizine for vertigo. Way too strong. I was knocked out immediately. And then the next day, I was still very, very drowsy. So I could not take meclizine anymore, because they want me to take it 3 times a day, morning, mid, and evening. And there's no way. I'll be asleep for like a whole week if I did that. I still actually have it at home. So they said I can take it on the days that I'm very, very dizzy, if I know I'm not working the following day. So we scratched that. And then I went to be seen at the emergency room because I was still very dizzy. They gave me a patch to put behind my ear. That helped out, but it didn't really do as much. I couldn't use it any longer. I couldn't use it any longer because it was actually peeling the back of the skin behind my ear on both sides, and I was still dizzy. But the weird symptoms started right after that, like the second week of June. The weird symptoms, as in like feeling stuck in my body, unable to move, unable to talk clearly, stuttering, having speech problems, having thinking problems, having fogginess in my head, having just feeling like really just spaced out. Once I come back to, I'm not clearly thinking. I knew what happened, but really did not know what happened. That happened for 1 week. Within that time, I was seen by by a primary care doctor. My doctor was completely booked up. She did EKG, she did orthostatics. She's like, yeah, you're dizzy. I can tell by orthostatics that measures your heart rate and also measures your blood pressure by laying, standing, and depending on the difference of your blood pressure, as in points wise. I will do another video regarding what orthostatics is, because I think that's very, very important to know. And she also ordered EEG, which is to check to see if you have epilepsy, or if you have epilepsy, or if you have seizures, which was negative. I don't have that. I'm so happy I don't. So within a week and a half, almost 2 weeks from that date, I think that was like the 15th, on the 26th of June, I had to go to the emergency room. It got even worse. I was at work. I couldn't respond to what they were telling me. I couldn't talk clearly. They were talking way too fast for me. I couldn't understand what they were saying, and I was very dizzy. So the doctor said, because I had mentioned it to her early in the morning, I said, I really need you to watch out for me throughout the day if you can. I explained to her what's happening. She's like, no problem, I'll watch out for you. At 7:30 in the evening, things went to the left. She's like, either you go to the hospital or I'm going to call 911. I said, no, I don't want to be transported to 911. I'll go myself. I went to the hospital on the 26th. By the time I got there, I wasn't able to walk on my own. I couldn't stand on my own. I couldn't sit on my own. I couldn't move on my own. Everything has shut down. They had to wheel me to a room. They did CT and MRI thinking I might have had a stroke or a seizure or whatever. They checked everything, all blood work, everything came back normal. They couldn't understand why I could not move my legs. They couldn't understand why I could not move my arms that well. The percentage, let's say if it's 100% before like on the 25th, I had 100% of movement of my body. On the 26th, I had 10% of movement of my body. That is a huge difference between like one day. So they said you can't go to work. They gave me a walker. I followed up with neurology. They have no idea what's going on. We've done EEG, which is to check for seizures and stuff. Like I said, we did EMG to check for muscular disease, which was all negative. I did 10 sessions of physical therapy. Helped a lot, much better than what I was when I first started. I couldn't even lift my leg when I first started. On the 10th session, I was much better, but not where I needed to be. I got discharged from physical therapy, but I asked for another 10 sessions so I could see them once a week so I can get back to my strength. As of right now, everything has come back to be negative, which I'm so happy for, but at the same time does not tell me what's going on with me. I still have muscle weakness. I'm still dizzy. I don't get as foggy as much unless I am beyond tired. I still have muscular pain, so they still don't know what's going on with me. I don't know what's going on with me. So since everything medically is coming back as negative, they might think it's psychological, thinking that my mind is going through something that nobody knows what's going through. So I'm seeing psychiatry, and I'm also seeing psychology. I actually saw psychiatry and psychology last week, and hopefully with those two appointments, I'll be able to be back to normal. I don't know, but this is going to take some time. I was on short-term disability, FMLA. I could not go to work for 6 weeks. Now I'm on light duty. It ends really soon, but I think they're going to extend it for another month or another 2 months. I don't know yet. But yeah, that's all I have. That's a lot. From May 21st to today, October 5th. That's a lot of stuff. But besides that, I don't have anything else. If I do update anything, it might have to do with my work-related stuff, but other than that, that's all I have for you guys. Make sure, please, I really do appreciate for all of the ones that have subscribed so far, but I really would love for my subscribers to go up and up and up. So make sure you subscribe, hit that bell button so that you'll be notified every time I upload a video, and also comment, like, and share. And the other videos I'll be posting, I will notify you guys what it will be about, but I think I'm going to keep it through medical/makeup. Yeah, but anyways, thank you for watching. Make sure you like, subscribe, share, and comment, and I will speak to you on the next one. Bye bye.